Welcome to the Daily Dose of Derm podcast, your go-to podcast for all things dermatology. I'm Dr. Mohiba Tareen, a board-certified dermatologist and the founder of Tareen Dermatology. Join us as we dive into the fascinating world of skincare, beauty, dermatologic treatment, and how to enter the world of derm. Whether you're a skincare enthusiast or an aspiring medical professional, this podcast is your daily dose of knowledge and inspiration. Get ready to uncover the secrets to healthy skin and discover how to make a meaningful impact in the field.
Welcome to the Daily Dose of Derm. My name is Natalie. I'm so thrilled to have Dr. Yun Kao with me today to be talking at our second episode of this series, all about women in the workplace, professionals, managing life, children, all of the things. Dr. Kao, thank you for being here today.
Thank you so much for having me.
It is an honor for me to have you. I can't emphasize to anybody listening how impressive your resume is, and also how wonderful of a provider you are. We're so lucky to have Dr. Kao at Tareen Dermatology here, but I want Dr. Kao to tell everyone listening about her background.
Yeah, thank you so much for those kind words, because truly I think one of the things that Tareen Dermatology has allowed me to do is be a good mother, be a good provider, be a good physician. And it's allowed me that balance. I grew up in New Jersey, spent most of my training in Boston, loved my years there. And then during residency was when I had my kids as well. And so once I started having kids, different times I was thinking about different priorities. And eventually, as my kids were getting older, it was really, really difficult to spend time between work and also taking care of them.
Yes.
Just a lot of family things. And so it almost felt like there were separate portions of my life where, as they grew up, I was experiencing childhood myself. And then during training, it was pretty much all focused on training, how to be the best doctor I could be. And then once kids came along, it's like a different stage of life.
Yes.
I always hear that there's like different seasons of life.
It's so true.
Yeah. And so every different season has felt like it's brought a different part of me out. And so that's where I ended up here.
Yeah, I love that. Yeah. And Dr. Kao is so humble. Dr. Kao is a graduate at Harvard Medical School. Tell me about your schooling there.
Yeah,
I know that they have like a 3 or 4% acceptance rate, maybe even lower than that for the medical school. But I know for Harvard as a university, they have a very low acceptance rate because it is so competitive. Talk to me a little bit about your medical schooling, and then when you decided to have children and you're married to a wonderful man. How did that all go with being in the midst of training and pregnancy and all of those things?
Yeah. See, where do I begin?
I know that's a lot of questions.
Well, I think the most impressive thing at Harvard were just the people. And people came from all different backgrounds. I remember the first time everybody was introducing themselves, you were just astounded by where people came from. Sure, there was somebody who grew up like first generation immigrant, had similar background to myself. And then there was also like the Navy SEAL who had like spent time abroad and fighting and is now pursuing medicine as a career now that he's out. And so all of these different backgrounds just bring so much to the table when you have conversations. And I think that's partially why like there is no major or a thing that actually leads to medicine specifically. I think med schools in general want people from all backgrounds of life. So I think being able to be colleagues with them and also work alongside them and just meet them as people is probably the most amazing part of med school. Not to mention like the medical training. Like, oh yes, yeah. But
really interesting perspective.
Yeah, and I think when we all started, like not many of us had kids, and not many of us were trying to. I mean, certain people I think were married, and I remember like a couple of people did have kids, and they were also always the most impressive to me because they would be the ones who are like super efficient with their time. Now that I have kids, I understand, but so efficient with their time and studying. And they were also had this like whole new family life differently. And so I had my kids during residency. So I think I wasn't even thinking about all of that during med school.
Right.
But then in residency, I think as people got older, naturally people started thinking more about it.
Yeah.
And so it was really wonderful to find people who were kind of in the same place as I was.
Right.
And it's so different nowadays. Like I think it used to be that people would delay having kids just as they were going through training. But I think in recent years, I think the narrative's actually shifted a little bit. I feel like people
see that.
Yeah, I do too. People are like, it's never a good time to have kids or start a family. Yeah. And
That's
so
so true.
you just do it and you kind of work your way around it. And then it also may change about what you want out of day-to-day life.
Right.
I was very lucky to also have like colleagues and even mentors who kind of like
Yeah.
talked about all of that. Yeah.
Did you have family around you that was able to help you? I mean, did you lean on your family for help during that time as well?
Yes, totally. I was very lucky. My mom came both times I had my baby. So in Chinese culture, we have this thing where like the month after having a baby, you have kind of like a sit-in where your mom just comes and takes care of you and the baby, and you get time to rest and all of that. And I was like, I think more people should have that. Yeah, exactly. And so she was so supportive. And then my in-laws were also so supportive. They were retired by the time they had kids. So it was kind of like months on end to be with us. And so, yeah, I definitely couldn't have done it without family. And it's really just really lucky to have them. And I know not everybody had that, but it's so, even with medical training, it's so important to have like a supportive partner and family.
Yeah, absolutely. And the field that you're in, Dr. Cow is a dermatologist and a dermatopathologist. So it's dual degree. So the program that you were in, I can only imagine was very challenging. It is very, very difficult to get into a residency program in dermatology. It's one of the hardest, I think, in the country to pursue. So bravo to you. Tell us why did you pick both?
Yeah, that's a great question. Yeah. I actually didn't enter residency thinking I wanted to do dermatopathology. It was a total surprise. And I feel like with my personality, so much of my life has been planned that it was the one thing that kind of like threw a wrench into things, which is great because it ended up being the best decision I ever made. But going into residency, I was just like, I want to see patients. I want to take care of them. And I was actually really interested in inpatient dermatology, like in a hospital setting.
Okay.
And that was kind of like a lot of my mentors had inpatient experience. That's partially what drew me to dermatology, was just the complex rashes, the things that can land people in the hospital. Whereas like most people, when they think of dermatology, like, oh, you're a healthy walking person. Like they don't really see the hospital side of dermatology.
Sure.
And then I met a couple of just really wonderful attendings teachers. Attendings are people who are graduated residency, and the ones that have both the derm path and derm training were just probably some of the smartest and most amazing people that I knew. No, and I wanted to be like them. They can look at a lesion or on a person's skin, and they can look at a rash, and they can kind of mentally see what it looks like under the microscope, and that just completely changed how they counsel patients about their condition,
Right.
what they chose to do for diagnosis and treatment. And it was really interesting. Like it's probably one of the few fields where the skin is so superficial that what you see under the microscope, you can kind of see the same contours, if you will, clinically, which I found fascinating. And
That is fascinating.
yeah, and so all of it, initially started from that, and then really kind of fortuitously, I also had a co-resident who was interested in derm path right off the start. And so it was really, really hard for me initially looking at histo because I was never really interested in medical school, to be honest. So I was not good at it to start at all. But I think being able to come back to something that you're terrible at and still find it interesting is fine. So he was the one that really got me interested in like actually pursuing it like a career. And we talked a little bit about how it's worth that balance, going back to having kids and motherhood. Like on days when I do derm path now, my schedule's a little bit more flexible. Right. If I have to be at home in the morning to, meet with my kid who's sick, I can come in the afternoon and be able to. Yeah, exactly. So that flexibility is really wonderful there. And I get to do what I love both. Like I love talking to patients, I love taking care of them, and then I come back to my office and they get to read their biopsy. So it's like the best of both worlds.
So, and I was just talking about this yesterday with a friend. Your children will get to grow up seeing their mother do something really cool and clearly doing something that she loves. So I think in our culture as moms who are working, we do often struggle with the guilt of this balance between work and home life and wanting to make sure, are we spending enough time with our kids? Are we spending enough time doing hard work, good work? But I always think, even with my children, who our kids are kind of around the same age, as little ones, they will grow up to know that they have a hardworking mom. Not any offense to any stay-at-home moms at all, because we know that they may have even a harder job than us.
Totally.
But I think that's a really cool part of this too.
Yeah.
It is that I think there's a bit of a shift in sort of like the working mom and what that means. Do you agree?
I totally agree. And I still have medical students come and ask me, it's like, well, how did you decide to do this? Or how did you decide to do that? And I think, at the end of the day, like what you want can change from the time when you were a trainee to when you become a mom. And I've seen some of my colleagues who like totally embrace the, completely being at work and they're totally fine. You know, it was like nothing has changed since they had kids. And then myself and a couple of my friends were like, something really, really big has changed. And then so we find a way to structure our days to, you know, have our cake and eat it too, so to speak, to be able to do what we love at work and train so hard for all our lives. But also, you know, our children have also become a really part of our lives now. And so to be able to be there with them. And I was luckily, you know, very lucky to be able to do that, having, you know, trained in dermat, that kind of like luckily stumbled upon this field where there is that sort of flexibility. But I think that's one of the hardest parts coming out of medicine, is you just focus so much of your life up until that point. And this is exactly what you want to do, but then to be able to pivot and have also luckily have the support system to be able to do that is really.
Now, everybody probably wants to know, do you have any techniques or, you know, scheduling strategies or anything that you use personally that makes you successful in your job while balancing your family?
Yeah, I actually say the number one thing is just that my husband stay at home. That's amazing. And that was yeah, seriously. Back to like, you know, not everybody can be a stay-at-home mom. I cannot. Full time, like full disclosure, that is not something that I was wired to do, you know? But that is such a good point. I totally and he is just the most patient, kind person. Like when my kids are having tantrums, it's like he can be there as just like a Zen rock. They're the entire 45 minutes, you know? And of course, I need to step out. So, yeah. And so just having him at home is like a huge mental load off. Like a lot of people talk about mental load now and how you have to like divide. And it was really amazing. He used to work. And then once we had kid 2, we had a conversation. We were like, all right, which one of us is staying home? At least part-time, you know, but he's loved it so much that now he's full-time there.
So great.
Yeah.
That is so great. I mean, that has to give you comfort in your days, right?
Totally.
To manage, you know, if you have a sick child, you know, you have someone you can rely on. It's not going to derail what you have going on at the clinic that day, or have to reroute your schedule to, you know, move patients and things like that. So, and I'm sure there's always going to be an exception to the rule. If it does require mom to be home, then you make it work. Right. And I think we all make it work.
Yeah.
When we need to shift a little bit.
We do. And I think it just kind of helps to lessen the guilt a little bit, because you're like, there's a parent at home, even if it's not me, you know?
That's so true.
And I remember back when we were both working, there was always that like, you know, whose meeting is more important? Or like, I mean, that was just like not a fun conversation you want to be having.
Yes. Was it can cause tension?
Totally.
Yes.
Yeah. And so, you know, part of the move here and part of the reason why I joined here is because there's just everybody's so kind here. Like, some of my colleagues, they have to go home on Fridays and see patients, and everybody has been so wonderful, be like, oh yeah, don't worry about it, you know, come back and do the work like when you have time. And so that culture of flexibility, of supporting families is so huge here.
It's so huge.
And it's just like, it's like, you know, we have a conversation about how we search for these things, but sometimes they're hard to find. And I know, you know, there are friends who are dual physician households who have to outsource everything, but they also we have conversations all about, you know, the mom guilt, the balancing the conversations about whose meeting is important. And it's so hard to make things work, but I was very lucky to have found a way to do that.
It's so great. Yeah. And Dr. Cow came to us from Boston. How do you like being in Minnesota?
We love it. We love it. So weird. My parents are just asking me because they're both retired now, so I'm trying to get them to move out here.
Oh,
and they're in New Jersey.
They're in New Jersey.
Yeah,
okay.
yeah. So they just retired last year, so they're actually both visiting this month because I'm trying to sell them in Minnesota. But they were like, well, what if you move here and you move away? And I'm like, we're probably going to be here until the kids turn 18 and go to college. So yeah.
And we're so
yeah, no, we love Minnesota. We love how kind the people are here. I think how kind people are is a little bit of a culture shock when we first got here.
Right.
People
give us an example. I'm curious.
Yeah, I think the first thing that happened to me is like I was walking into Aldi and I was like forgot to bring a quarter because I haven't shopped at Aldi forever. And this like lady saw me fumbling with my purse and she just randomly comes, like, here, have a quarter, honey. And she just like walked up and I was like, wait, do you want your quarter? Yeah. And she's like, no, it's okay. Yeah, and I think people just notice when you're struggling. Like I run a bunch of time and they just like wordlessly come up and help. And it's it was just like a very warm and fuzzy feeling. And I had a co-resident in residency who spent some time in like Case Western, Ohio and stuff. She's like, oh yeah, that's midwife culture for you.
And so Minnesota,
yeah.
I mean, growing up here, we have witnessed that, and I feel like it's just sort of this innate thing that you want to be nice to your neighbors. And I don't know, my mom and dad always said, be a good neighbor.
Yeah.
You know, be a good friend, be a good neighbor.
Yeah.
All that. So I'm glad that you love it.
Yeah. We love that.
Social place.
Yeah. I actually think that having, seen a lot of my patients, I'm so impressed by how medically literate they are, how thoughtful they are about their own diagnoses. Like just the questions they ask and how they communicate over the phone. We like call them about results. And it's just, it's definitely been something that I didn't feel like I saw in Boston.
How interesting.
Yeah,
That's really interesting and lucky for you, but also lucky for all of our patients, because the feedback that I've seen from patients who see yours, it's like it's unmatched. I mean, you're so well loved and you take such great care of patients. I noticed throughout your career that I feel like you love being a mentor. Quite honestly, we know that you have this mothering, nurturing side of you, but you're just as equally intelligent and smart. But I feel like you like to be a mentor. Is that accurate?
Yeah, I get a lot of I guess like satisfaction, but also just like I love seeing people become themselves or like become the best version of themselves. Yeah. And I see that a lot in kind of the MAs that work with me now. People who are trying to decide whether they want to be a PA or do they want to be an MD or do they want to do something completely different than clinical medicine. And it's like when you see that spark of like, oh, I realize like this is what I want to do with my life. Or like, wow, I didn't realize that condition, that's how you explain it to a patient. Or this is how you treat, or that makes so much sense. That kind of light bulb going on in people's head. It feels really powerful to kind of be part of that and be a step in helping make that happen. And I personally had so many amazing teachers growing up, all the way from like my third grade elementary teacher, but I still remember.
Oh, how cool is that?
Yeah, to probably the person who made the first biggest impression on me, all the way till college, having amazing fellowship mentors, med school, people who got me into residency, who probably would have made it into derm residency without them. And so all of these people who championed me along the way, it's like my way of, being that person, giving back, but also just, wanting to also be like them and be able to kind of continue because the most important thing you can do is, like, for example, if I teach an MA something, when they become a doctor, they'll pass it on to somebody else, and almost like leaving a legacy behind and just spreading all of your knowledge.
Amazing. You're amazing. Dr. Powell. I want you to think about if you have any advice for any maybe moms thinking about becoming moms or worrying about becoming a mom and working. Do you have any advice for women listening?
Yeah, I think the most important piece to think about is that you can always choose something different. And that took me a long time to get there. I always thought that if I had everything planned out, I would just kind of follow the route. And it was actually working with a career coach at my last job that changed my mind. I remember having conversations with her and we'd be talking about like how I felt, how my day was going. And at some point she was like, I hear a lot of this kind of stuff that you're expressing, but what are you going to do about it? And so that idea of like, if you don't like something, you can change, you can choose a different path. You're trying to balance work and kids. Like, it's okay if you're somebody who prioritizes your kids, but it's also okay if you'd rather work. And
yes,
I think so much of our feeling of like mom guilt and personal dissatisfaction comes from a lot of what we're seeing out in the world, like social media, for example.
It can be so misleading.
Exactly. Just seeing a snippet of somebody's life and whether somebody feels like they have the right balance doesn't necessarily reflect whether you also feel. So I think giving yourself some grace, giving yourself some kindness, and treating yourself kindly, and realizing that if you're not happy with the way something is, like, you have the power to change it.
Right.
And you don't have to always want what somebody else wants.
It's such great advice. Now, I want to talk a little bit about boundaries. That's something that can be hard to set.
Yeah.
I know for me, I really try hard when I'm done with my work day.
Yeah.
When I want to put my phone down, I want to see with my kid. How do you manage that? Do you feel like you manage it well?
Yeah, it's definitely a work in progress.
Yeah.
Like you said, putting the phone down is probably the first thing. Yeah, I think I'm pretty good at that now, where I have a little drop zone when I get home now.
I like that.
Yeah,
A drop zone.
so I like literally put my phone there, and when I first see my kids, my phone goes there, and then by the time they get to bed, I don't look at it again until they get to bed.
I love that.
My Apple Watch kind of put a little kink at the plan, because then I had notifications. I had to shut up all the notifications on my watch. Exactly. So it's always a work in progress.
Yes.
But definitely that. And then I think I'm also putting on different hats. Like I also think of it like when I take a moment, I come home and I sit in the car. My husband actually helped me with this. And he was like, just take a moment and like take off your work hat and like put on your mom hat. And I always tell myself like, yes, I get to see my kids now, or like I get to play with them, you know, even no matter how tired I am. I always say, you know what, before I step in the house, it's always like, yes, you know, I'm treated as like a positive experience. So then I feel like I'm so much more centered, patient.
Yes.
And
It does take patience.
it's a lot of patience. They are 2 and 4.
Yeah. So I'm two, mine are 2.5 and 4.
Yeah.
With the same.
Yeah. Did you find yourself becoming more patient once you
Well, I think, oh gosh, yes.
Yeah.
Yes. But it's
Yeah.
it's a balancing act for sure, because I think when you're a really motivated person and you want to check all the boxes and make sure you're keeping up with emails and all of those things, it does take hard work, in my humble opinion, to say this can be put on pause between the hours of 5:30 and 8. You know, that's my time with my kids,
Right.
because we do get pulled, and that's the nature of sort of how the world is right now. But I do really try hard. I love the idea of a drop zone. I'm going to implement that. Like, that is really good advice.
Doesn't always work, not 100%, but like
Yeah.
80% of the time, almost there. So yeah.
So with successful people like you, I always ask about sleep habits.
Oh my God, I'm the worst.
But you know, with little kids, though, you know, like you might have one or both of them up in the middle of the night at some point. But tell us about your sleep habits as a professional.
Gosh, I'm literally the worst. Neither of my kids sleep well.
Okay.
I'm so jealous of all my friends whose babies sleep through the night at 3 months, and they're like unicorn babies.
They are unicorn babies.
Yeah, and neither of my kids are like that. Both of them love being cuddled, so there's a lot of cuddling. Yeah,
Mom and dad.
yeah. And that's something that I really had to come to peace with. Like, I think when I had my first, there was so much information about sleep training out there. Again, the long girls. And then it took me a while, but eventually I was like, yep, I'm just not going to be one of those people who can sleep train, because I just cannot stand my kid crying. And so that you know, part of what we talked about before about just like accepting that what you do might be completely different from what somebody else does. So then my kids are sleep trained. We still get up in the middle of the night.
Yeah.
You know, my husband and I thankfully kind of trade nights now. We trade nights, who puts them to bed. Yeah. So good for you. Yeah. So every other night I'm like, okay, after dinner when everybody's in bed, I just have some time to myself. So like, you know, that's really huge.
Yeah. How do the kids handle it? Are they
great question.
They're fine with it?
It was hard in the beginning. Never. Yeah. And every kid has always the preferred parent, you know, and so it's hard. And so at first, and comes with daycare, comes with bedtime, comes with everything. You know, you just have to be okay with them being resilient and being like, one parent is always with you. So it's okay if it's not me. Yeah.
We're really struggling with that at home.
Oh, is that right?
Well, I feel like my kids are like tree frogs on my legs.
Yes, you're the preferred parent. Yeah.
I'm like, Dad is awesome.
Yes, exactly.
Yeah, it's okay if Dad wants you dressed for school.
Totally. But like, as soon as you leave, they're like, Dad. But
yeah, and I'm like not even a problem.
Right.
It's just
right. And like my kids in daycare, like when they fall down, they'll scream, Dad. Like, it won't be me. But like, yeah. And so they eventually got around to it. Now they're like, okay, today is dad night and tomorrow is mom night, and they know the routine now. So
I've learned, and it sounds like you're in the same vein of thought here, is that kids just need stability.
Yeah.
We're really lucky to be able to provide that for our kids. Yeah. So they know they can trust dad. Yes. They know they can trust mom.
Yeah.
And they're flexible with it. I might need to try to work that into the mix. We've got drop zone. We've got switching nights for mom and dad. I like this. When you think about future you as a provider, as a dermatologist, as, you know, from the scientific side of things in dermatopathology, yourself as a mother, as a wife, as a friend, what do you think about future Dr. Cow?
Yeah, I think my main goal for the future is just being able to adjust as seasons come and then work a lot of maybe things that I used to really love back into the routine as my kids get older,
Yeah.
kind of like how we've been talking all along, like there's a time and place for everything, and learning to be happy with what I have going on now. And then as, things change, like maybe my kids will get into an activity and I'll really love doing it with them. Or maybe I'm trying to get one of my friends to move to Minneapolis so we can be coworkers. Like maybe that'll happen. My kids will have like amazing kids their age to grow up with. And I'm sure that'll change my daily routine. Like imagine like Saturday mornings where it's like open door policy between our two homes and like seeing what that entails. So I think I definitely have a bucket list of what I'm hoping to enjoy and achieve out of life. So it's just a matter of like figuring out ways to do that. And I feel very lucky to have found Korean dermatology to help on the professional side so far. And so it's opened up so many doors to be able to be a better person, from a personal standpoint. And so I love being here, and it's just given me so many opportunities to also better myself.
I love hearing that. And we're equally as honored to have you.
Yeah.
I mean, really. So you're a diamond in the rough. It is rare to find somebody like you who is kind and just so lovely and intelligent.
The feeling is mutual for sure.
So it really, your story will inspire so many people listening. And we really thank you for being here today. Any last words from you? I know you kind of gave us your advice, but maybe any students listening, any last minute advice for them on medical schooling while we have you?
Yeah, thank you so much for having me. I always tell people it's invaluable just to have somebody that you can talk to personally. And so my door is always open. If anybody wants to reach out, more than happy to talk through, and share my own experiences in case that helps kind of you think about your own experiences and where you want to go in life. And always happy to chat. So.
And that's the mentor in her. So thank you for being here. This has been an awesome episode. Please follow, share with anybody you think would love to hear Dr. Cow's story. This is the Daily Dose of Derm. Stay curious and stay inspired.